A new study published in the Lancet Global Health Journal shows nearly 27% of Canadians, about a quarter, have an underlying health condition that increases their risk of severe COVID-19 illness. With more on this, I want to bring in CTV's medical specialist, Dr. Marla Shapiro. Good morning, Dr. Marla.
Good morning.
Does this study come as a surprise to you when it suggests that more than 9 million Canadians have a chronic condition that's identified as a risk factor for severe COVID-19 symptoms?
Not really, because it's encapsulating that group of the population that has diabetes, cardiovascular disease. And if you look at worldwide stats, about 22% of the global population runs these risks as well. So 27% is a little bit higher than the global estimate, but it does mean that 9 million people within our country would be the highest risk in terms of a severe outcome if they were to contract coronavirus. And that's why it's so important that we mitigate against this particular group of population, putting themselves out of harm's way.
What are some of the underlying health conditions that would increase a person's chances of developing symptoms in a more severe way?
So anybody who's immune compromised, either by a condition or by a medication, the population that we've just identified as having diabetes, obesity, cardiovascular disease, that's the group. And if this group was left unchecked, that means about 1.8 million of them would end up in hospital. And most of the individuals in hospital are over the age of 70, about 20% are the ones that really get into trouble. So this particular group, as we open up, is a group that really has to strategize as to how do I go forward, even as we move forward into phase 2, given the fact that you're a higher risk population. So you have to interpret what we're doing in terms of you as an individual and what your individual risk may be.
Well, let's talk a little bit more about that. What does the study say about people focusing on staying healthy in order to reduce their risk of developing severe symptoms?
Well, I think, what it's saying to you is that you want to make sure that you're controlling all the risk factors that you possibly can. So diabetes, hypertension, you want to make sure that you're reaching your targets in terms of diet, medication, following that blood work, and not forgetting that even during this period of time, you don't want to avoid seeing your healthcare provider. We know that people are avoiding their healthcare providers in droves because they're afraid of going in to see a healthcare practitioner. So you don't want to abandon your routine healthcare because you want to stay at home. You've got to make sure that you're attending to your health.
Okay, and on that note, let's close out by talking about that second wave of the virus that we hear so much about. When do you think that might happen, and how can everybody prepare for that?
Well, firstly, we're still in the first wave, and we're seeing numbers increasing in different areas as they open up. And it's not just because of increased testing. It has to do with the virus itself and transmission in close groups. So as we move forward, I think still keeping an eye on social distancing, wearing masks in areas where you cannot, I think that's still something that you might want to consider. It's certainly something that we're advising individuals, particularly at higher risk, to make sure that they keep doing.
Okay, Dr. Marla, thanks for that. Really appreciate it. We'll see you next week.